We are the Wake Forest School of Medicine Infectious Disease Interest Group.
We asked students at our school what questions they had about antimicrobial resistance and stewardship.
So, how does antimicrobial resistance spread?
Hi, I'm Dr. Vera Luther at Wake Forest University School of Medicine. Antimicrobial resistance is a naturally occurring phenomenon. It's something that we see in bacteria, viruses, in fungi, and even in parasites. And it's something that occurs naturally that the germs or organisms do as a way to protect themselves. We have noticed that organisms will evolve and become more resistant when there's more antibiotic pressure or antimicrobial pressure. That's something that can speed the process along. And again, it's a self-defense mechanism on the part of the germ. And so antimicrobial resistance can spread then once this phenomenon occurs, really in the same way that infections are spread. So we can transmit antimicrobial resistance from human to humans through direct contact, through things like coughing and sneezing, or even through sexual contact. We can also pick up antimicrobial resistance from our environment. So human activities can contaminate the soil and other environments and can contribute to resistance and the spread of resistance. That's one way that antimicrobial resistant organisms can get into our food source, actually, is from contaminated soil. And then we can have contamination of animals. So contamination of animals that humans consume, and particularly when those animals are fed antibiotics, usually for growth purposes, those animals are more likely to have antimicrobial resistance, and then people who consume that meat are at risk. And then we can even pick it up by direct contact with animals who may be colonized with antimicrobial resistant organisms.
I'm Ryan Maves. I'm a transplant infectious disease physician here at Wake Forest Baptist Medical Center. So antimicrobial resistance is spread through a variety of pathways. In the hospital, where a lot of us work and where I primarily work, the major ways that we worry about it are through contact, often by healthcare professionals, so physicians, nurses, other members of the team, transmitting it between patients. Now that's one of our big concerns, and we've thankfully been able to implement a lot of approaches within the hospital to prevent that from happening. Strong emphasis on hand hygiene, barrier precautions, and other forms of contact precautions to minimize the transmission in patients known to have or suspected to have antimicrobial resistance. More broadly, in the larger community, one of the major drivers is the inappropriate use or overuse of antibiotics. So extended prolonged courses of therapy for patients who can get by with shorter, more focused courses of antibiotics. Use of antibiotics in patients who do not have bacterial infections is another big use. And kind of globally, one of the big drivers is actually agricultural use of antibiotics in animals that we use for food. This tends to lead to a lot of resistance downstream. For example, Campylobacter, common cause of diarrhea, having very high rates of drug resistance because of the use of antibiotics in chickens.